Order. We come first this afternoon to a debate entitled National HIV Testing Week 2023. I call Maggie Throop to propose the motion.
Thank you. And I beg to move that this House has considered National HIV Testing Week 2023. It's a pleasure to serve under your chairmanship, Mr Gray, this important and very timely debate today. In the 40 years since the untimely death of Terence Higgins, who was not only the first recorded British person to die from HIV/AIDS, but also a Commons Hansard reporter, one of our own, we have made huge progress in the testing, diagnosis and treatment of HIV to the point where today people living with HIV can continue to lead very normal lives. It's essential to remember, however, that HIV remains a critical global health issue, with millions of people living with the virus and many more at risk of infection. Early diagnosis and treatment of HIV is essential in reducing the spread of the virus, improving health outcomes, and reducing the stigma associated with the disease. Charities such as Terence Higgins Trust, National AIDS Trust, and the Elton John AIDS Foundation have worked tirelessly to lead the fight against HIV. I would like to thank them for the phenomenal work they have done and continue to do to help those living with HIV and to achieve the goal of no new transmissions by 2030. At this point, I would like to take the opportunity to personally thank the outgoing Chief Executive of the Terence Higgins Trust, Ian Green, for his hard work and dedication to the charity over many years, and more broadly for his immense contribution to the fight against HIV. I'd also like to congratulate Richard Angel on his appointment as Ian's successor. He's got big shoes to fill, but I have no doubt that he's more than capable of doing so and stepping up to the challenge and driving this important work forward into the future. As members will be aware, human immunodeficiency virus, HIV, weakens a person's immune system and their ability to fight everyday infections and disease. HIV is passed from human to human, and if left untreated, can progress through a series of stages and lead to acquired immunodeficiency syndrome, AIDS. Although there is currently no cure for HIV, there are treatments available which enable a person to live a long and healthy life. A person living with HIV has a similar life expectancy to an HIV-negative person, provided they're tested and diagnosed in good time. As the House knows, TV is one of the most powerful tools at our disposal to help educate the public, with award-winning dramas like It's a Sin, again bringing HIV to the forefront of the national consciousness. I'm not sure if we've got any EastEnders fans here in the chamber today, but if we have, they will know that the character Zach Hudson, played by James Farrar, has recently been diagnosed as being HIV positive. The storyline portrays Zach's struggles about coming to terms with his HIV diagnosis and his difficulty in opening up to his friends and family. I'd encourage members, perhaps over the forthcoming recess, to catch up on these powerful episodes of the Albert Square soap, which perfectly captures the stigma around HIV and the challenges those living with the virus continue to face. I also hope that this storyline will encourage more people to take an HIV test. During my time in government, perhaps the work I'm most proud of is bringing forward the new National HIV Action Plan with the clear aim of reducing new infections by 80% by 2025 and, crucially, ending infections and deaths from HIV by 2030. As Public Health Minister, I was clear with colleagues across government, as well as in the NHS, that this goal could only be achieved if the plan was properly financed. By securing over £23 million of new funding to support the work needed to deliver the action plan, including scaling up HIV testing in targeted, high-risk populations, including in the Black African communities, and increasing access to the antiviral drug PrEP, I'm wholly confident that we can and will eradicate HIV in the UK by 2030. Despite progress over the years, the Terence Higgins Trust have estimated that there are still 4,400 undiagnosed people living with HIV in England. And I challenge the Minister to play his part and commit to finding these undiagnosed people so that we can achieve our goal of zero new transmissions by 2030. In order to do this, we need to encourage more people to test for HIV and expand opt-out testing across the UK and especially in high prevalence areas. This week, across the country, including here on the Parliamentary Estate, we've been marking National HIV Testing Week with a number of different events taking place to raise the awareness of HIV testing. This annual campaign aims to raise awareness about the importance of regular testing to help reduce the number of people living with undiagnosed HIV and those diagnosed late. This year, the campaign has a new strapline, I Test, and this now replaces Give HIV the Finger, which has been in place for the last 5 years. And I want to urge everyone to take advantage of the services available during HIV Testing Week and throughout the year to get tested and know their status. 40 years ago, testing for HIV was limited and often difficult to access. We'd only just begun to understand what HIV was, including the variants of it and the potential impact that it has on health. Charities such as the Terence Higgins Trust were established and at that time could only offer support and advice to HIV positive people. Fast forward to today and the contrast is evident. For the first time this year, during National HIV Testing Week, in addition to the traditional test, people in England are able to order or collect a rapid home HIV test where results can be known within 15 minutes. This test operates similar to an LFD test that we all became so familiar with during the pandemic, but only needs a few drops of blood from a small prick on the finger, and results will be known promptly after. This now means that for the first time, HIV testing is quick, free, confidential, easy, and will certainly save lives. I'd like now to address the steps that government has taken to tackle HIV. Over the last few years, the government and charities have worked together to try and achieve the goal of eradicating HIV transmissions in England by 2030. In 2019, the then Secretary of State for Health and Social Care, the member for West Suffolk, set a goal to eradicate HIV transmissions in England by 2030. In fact, I think he was set the challenge by my honourable friend from Winchester. This led to the launch of an independent HIV commission supported by the Terence Higgins Trust, National AIDS Trust and Elton John AIDS Foundation. The aim of the Commission is to develop evidence-based recommendations to end HIV transmissions and attributed deaths within the 10-year time period. The Commission's report that was launched on World AIDS Day 2020 made 20 recommendations. In relation to the testing, the Commission outlined that the single most important intervention to meet the 2025 and 2030 goals was to make widespread HIV testing readily available across the NHS and delivered as opt-out, not opt-in testing. At the current rate, it is possible but not probable that we will achieve that 2030 goal. There needs to be a concerted effort by the government, HIV charities and the NHS to come together to turn this vision into a reality. As the HIV Commission's outlined, opt-out rather than opt-in HIV testing must become routine across healthcare settings, starting with areas of high prevalence. And I firmly believe that if we want to become the first country in the world to achieve zero HIV transmissions by 2030, we must rapidly expand opt-out testing at the earliest opportunity. In particular, opt-out testing, which is a scheme whereby a patient can explicitly decline or implicitly accept an HIV test, can help to make sure that the UK is the first country in the world to eradicate HIV transmissions by 2030. An opt-out programme refers to when a patient visits an accident and emergency department and is offered a discrete test which screens for HIV, Hep B and Hep C viruses, when blood is taken for other tests, which is usually the case for most A&E attendances.
Will she give way?
I will give way.
I'm very grateful to her giving way, and she's making an excellent contribution. Isn't one of the real benefits of the opt-out testing that it starts to chip away at what remaining stigma is left with HIV and HIV testing by normalising it?
The spokesman for the opposition makes exactly the right point there, in that one of the ways that we're going to help take up the, to achieve our goal for 2030 is by taking away the stigma that sadly does come with people who are testing positive for HIV. But the thing is that nobody's forced to take the opt-out test. Nobody's forced to actually take the test, and the patient is allowed to opt out. But I'm led to believe that very few people actually do opt out. And since the adoption of opt-out testing in the very high prevalence areas, there's been some notable successes. It's clear that opt-out, that this is actually saving lives by the way that it's now being carried out. In the first 10 months, A&E departments in London, Brighton, Blackpool and Manchester have seen 261 people newly diagnosed with HIV, and that's in addition to 137 who have been found who were previously lost to care. Additionally, 710 people were newly diagnosed with Hep B and 288 people were newly diagnosed with Hep C. Crucially, this means that people can access the treatment they need to live a normal life, and it means they cannot pass on the virus unknowingly. So opt-out testing has a number of benefits to the NHS too. In a time when the NHS is under increasing pressure, both in terms of the backlog and funding, opt-out testing can help relieve both of these problems. Research from the Terence Higgins Trust has highlighted that in the first 100 days of the scheme, opt-out testing has only cost the NHS £2.2 million. It has saved an estimated £6 to £9 million in healthcare and costs. And this is so well illustrated at Croydon Hospital, where opt-out testing has been taking place for some time now. Before opt-out testing, the average hospital stay for newly diagnosed HIV patients was 34.9 days. After 2 years of opt-out HIV testing, the average stay is just 2.4 days. This frees up hospital beds, which in turn will help to reduce the backlog. And this shows that opt-out testing can benefit the NHS and the patient. The pandemic clearly had an impact on HIV testing and may have affected the possibility of reaching our 2030 goal. According to the UK HSA, the total number of newly HIV people diagnosed in England decreased by 33% in 2020. Reasons for this include the impact of the unprecedented public health restrictions and the strain on health services resulting in a decline in HIV testing. And although COVID accounts for the fall in testing, to give us a fighting chance of being able to meet the 2030 zero transmission target, we need to address the following problems. And therefore I want to ask my honourable friend, when he winds up for the government, to consider the following points during his closing remarks. First, the rollout of opt-out testing in high prevalence areas, not just in the very high prevalence areas. And despite the fantastic achievements of the opt-out testing in the very high prevalence areas, we do need to do more to undertake testing in areas of high prevalence. A high prevalence area is classified as being between 2 to 5 per 1,000 people in the local population being HIV positive. Currently, there are 32 areas of high prevalence outside of London. Cities that are classified as being in this class include Bristol, Liverpool, Derby and Nottingham. And of course, with my constituency of Erewash sitting between Derby and Nottingham, I do have a vested interest. The National Institute for Health and Care Excellence, the British HIV Association and the British Association for Sexual Health and HIV and the British Infections Association all recommend routine HIV testing in areas of high prevalence for anyone having a blood test for other reasons. Despite this guidance, there is no Department for Health and Social Care or NHS England funding and no route map for opt-out testing in areas of high prevalence outside of London. So if we are serious about meeting the 2030 target, the government does need to expand opt-out testing across the country and specifically in high prevalence areas. This form of testing has been extremely successful across London, where a decision was taken to fund opt-out testing, not just in the boroughs with very high prevalence, but in the boroughs of high prevalence too. It is estimated that a further £18 million is needed to expand opt-out HIV and blood-borne testing in 40 hospitals in 32 areas outside of London. Anyone who leaves an A&E department who is HIV positive and is not diagnosed is a missed opportunity. Secondly, we need to reduce the chances of late diagnosis. It's reported that in 2020, 42% of all people diagnosed with HIV were diagnosed late. The impact of this can be extremely damaging. As well as unknowingly passing the virus on, late diagnosis is associated with a 10 times greater chance of mortality in the first year. Additionally, late diagnosis can have a detrimental impact on an effective response to treatment, which in turn leads to greater healthcare costs at a time when there are already financial strains in the NHS. Late diagnosis particularly affects certain groups. 54% of heterosexual British black Africans and 29% of gay and bisexual men were diagnosed late. Opt-out testing has allowed us to identify that these groups are the most likely to be HIV positive. Although opt-out testing highlighted that these groups were most likely to have HIV, we need to encourage more people from these groups to get tested. A simpler solution to encourage more people from these groups to get tested could be via public message campaigns. Targeted messaging across radio, television, social media could be created which encourage people to come forward and get tested. It could also specify the importance of testing and inform where the local test centre is. Let's face it, during the pandemic, it became second nature to go to a COVID testing centre or a vaccination centre outside of the usual healthcare setting. In a similar way, pop-up testing centres could be a useful way of reaching out to the hard-to-reach communities. Research by the British HIV Association has shown that many people have missed opportunities to test for HIV in primary and secondary care. The most common clinical-related barrier relates to the failure to appreciate HIV risk or to properly diagnose it. Other barriers include time pressures, clinicians not seeing it as their role to test, perceived need for pre-testing counselling, and unfamiliarity with test discussions. Clearly, all of these factors can lead to a late diagnosis and ultimately greater health risks. Ultimately, to address late diagnosis in both primary and secondary care services, HIV testing needs to become a more prominent across the entire NHS estate, primary and secondary. If we want to turn the UK into a science and health superpower, and if we want to achieve no new cases of HIV by 2030, it's essential that we address this issue that I've highlighted. In particular, it is absolutely vital that we rapidly increase testing levels in high and very high prevalence areas through opt-out testing. Not only will this save the NHS money and reduce the backlog, but it will enable patients to know quickly whether they have HIV. So my challenge to the Minister is to fight the corner for the funding needed to expand opt-out testing to all high prevalence areas. In this way, this time next year, when I'm sure there'll be another debate on this subject, we can report that we are back on track to hit that goal of zero new HIV infections, AIDS and HIV-related deaths in England by 2030. As well as saving lives, the Minister's actions will also have saved the NHS quite a considerable amount of money. If we implement this properly, our country will continue to lead the way in this area of healthcare and achieve the status of becoming the first country worldwide to eradicate HIV. Thank you.
The question is, this House considered National HIV Testing Week 2023. Jim Shannon.
Thank you, Mr. Gray, for giving me a chance to speak in this debate. And can I first of all thank the Honourable Lady for Airwash in Derbyshire for setting the scene. As my party's health spokesperson, I always find it as imperative that we speak out on these issues. I've done so in the past. I don't think there's been an HIV debate that I have missed, whether it be in Westminster Hall or even a question on it in the Chamber. So I'm very pleased to come and participate. How wonderful our NHS is they've been instrumental in providing support and care for us all, and where would we be without it? In terms of HIV, we have come on leaps and bounds from the late 70s and 80s in terms of diagnosis, of support, of treatment, and indeed of the stigma. And I think it's good that we are where we are today, because I think it has shown progress and positive progress, which I would be very much in support of. Also a pleasure to see the Shadow Minister in his place. Seems only like yesterday, last Thursday, we were in Westminster Hall on cystic fibrosis. I'm very pleased to see the Minister in his place as well. I know the Minister will be positive in his responses to the questions that we ask. He always is, and I know we very much appreciate that. However, as we move on, there is always more we can do to improve diagnosis and keep people as healthy and as safe as possible. So it's great to be here to discuss these important matters. I just maybe should put it in record, my thanks to the Honourable Lady for her wish as well in relation to diagnostics. This morning, the Honourable Lady set up the APPG in this matter. And again, I want to commend the Honourable Lady for that there. And she has many supporters from within her party and also from other parties who wish to see things going in the right direction. In 2021, there were 2,955 people diagnosed with HIV in the UK. The number of people being newly diagnosed has been decreasing for over 15 years from a peak of 7,892 in 2005. So there's a steady progress of decrease. And that's down, in all honesty, to the strategy that the government and the Minister has. Also the strategies that the local regional administrations have, including my own Northern Ireland Assembly back home in Northern Ireland. Most people with HIV, some 95%, know their status because they have been diagnosed. And we have a very, very clear strategic plan back in Northern Ireland of making it easier to be diagnosed, and the success rate of that, as the Minister will know, by the way, because I'm quite sure the Minister has done his research before he comes here. Northern Ireland has probably led the way for the rest of the United Kingdom and what we've done in respect of that. In 2020, 60 people were diagnosed in Northern Ireland with AIDS. 47 of that were men and 13 were ladies. So it's important to note, Mr Chairman, that historically there were stigmas surrounding AIDS being tested for and moreover being diagnosed with it. That stigma, I believe, is disappeared because the eagerness amongst the large majority of people is let's get diagnosed and let's see if we have it and then start the treatment process. So today we can, in solidarity and in fact encourage people to get tested, and I want to make that statement for myself. I think others will want to make it as well. In Northern Ireland, you can get a free HIV test and receive comprehensive medical care and support. This is also very widely available from all health trusts, and HIV testing kits can be ordered online and delivered straight to your home. You can do it as we do many things. We do shopping, we can do this online. So Northern Ireland, perhaps in a way, Mr Chairman, leads the way. The National AIDS Trust and the Terence Higgins Trust have been in contact with my office ahead of this debate, so I'm very pleased to add in some of their evidential base and information into my contribution. They have emphasised the importance of the opt-out HIV testing needs to be expanded to all areas with a high prevalence of HIV. So maybe the Minister in this question could maybe tell us what's been done to address where the areas of high prevalence, so we can see, which I'm quite sure it is, there's a direct strategy to address this. It is estimated that the first 100 days of the scheme cost £2.2 million so far and has saved the NHS an estimated £68 million in care costs because those diagnosed have been able to initiate treatment. It really is, Mr Chairman, a win-win. Diagnose early and save money in the care later on down the line. It is estimated that a further £18 million is needed to expand the opt-out HIV and blood-borne virus testing to those 40 new hospitals in 30 areas. But this would in turn result in savings. So Minister, again, I always ask in a respective fashion because I'm always looking for the answers. And will the Minister's Department set aside that further £18 million to ensure that happens? In addition, the opt-out testing finds people more likely to be diagnosed late by other services. 54% of people diagnosed with HIV in the first opt-out testing A&E pilots were of Black African and Black Caribbean or Black other ethnicity. More than twice as many as the nationwide average. The Honourable Lady referred to that in her contribution and setting the scene so very well. 35% of them are women and 10% were aged 65 or over. Again, that's a target area. The Honourable Lady asked for that. I would reinforce her request to have us as well. Between 2021 and 2022, HIV testing has still not returned to pre-pandemic levels, with testing rates 20% lower in 2021 than in 2019. So I think there's something that needs to be done there as well. This has been driven by a 22% drop in testing amongst women and a significant 41% drop in testing amongst heterosexual men. I would suggest that if you haven't taken usage of the testing, HIV testing, then it needs to be done. So this debate in HIV Testing Week aims to promote regular testing, particularly amongst groups most affected by HIV in England, including the gay, bisexual and men who have sex with men, and black African and black Caribbean communities as well. Testing options across the United Kingdom do vary across the country in administrations. I think we are leading the way, Mr. Chairman, in Northern Ireland. I'm quite sure that everybody else's ambition will be to catch up. So it's important that our constituents know their first port of call should suspicions of HIV arise. I want to make a wee plug if I can, Mr. Chairman, and for what some of the organisations in my constituency are doing, and just give one an example. There's many, but just give one. The Elim Church in Newton Ards, one of the churches there, are very active missionary ways across in Africa, in Swaziland or Eswatini as it is now, and in Zimbabwe. There's high prevalence of HIV in those countries, and they were keen to ensure that the help for HIV for those orphans, first of all, who have lost their parents due to HIV, but also to provide health treatment, an orphanage for them, to provide education and job opportunities. And I think that that Elim Church, that missionary-based church, deserve to be commended for what they do in those two countries in Africa. Every year, the Missionary Society always sends over some of the children and the choir to sing, and I attend those events every year. But it always reminds us of how things were, but how things can be. And I think that's what it is. So it's the ambition of change, and very clearly the Elim Church has done that. So again, not the Minister's responsibility, but just to ask. I'm quite happy if the Minister comes back at a later stage with us here, just to keep us all informed. What discussions has the Minister had with the SCDO, Secretary of State, in charge to promote that fight against HIV in other countries? I know they're doing it, but just be keen to know that the same focus and attention and authority is given to that. So to conclude, Mr. Chairman, it's important we do all we can to encourage early testing for early diagnosis for better treatment. There is potential to get and continue the HIV testing and keep going and protect life from illnesses and possible death. So I'm very encouraged by what government's done, but I also call upon government in conclusion to ensure sufficient access of HIV tests, and thank our health trusts and our GPs for providing the free testing for all that many of them do, including in particular in Northern Ireland. Mr. Chairman, thank you so much.
Steve Brown.
Thank you very much. Chairman Gray, very nice to see you in the chair, and thank you to my honourable friend from Erewash for setting out the opening to the debate so well as she did. I would echo her comments about the outgoing Chief Executive of THT, the Terence Higgins Trust. I've known Ian for many years, and his leadership really made sure that they were the first organisation to take the U equals U message out there, and the can't pass it on. Such a simple campaign, such a simple message, and that came through the clarity of thought that Ian brings to that organisation. I think equally, you know, his leadership, as has been mentioned about the post. I mean, the first home self-test postal service and the creation of the HIV Commission that I'll come on to came through Ian's leadership. He's also a lover of Labradors, which makes him a good person in my book, Mr. Gray. So thank you very much, Ian. Wish you well and good luck with your new positions. I look forward to seeing you soon. So, you know, as has been said, I mean, HIV emerged, some 40 years ago when I was a mere slip of a schoolboy, and created that epidemic that still dominates some people's lives, and obviously ended many too soon, and scarred many more. In the 40 years that since then, and I knew nothing about HIV, Mr. Gray, when I became the Public Health Minister, I knew nothing other than the tombstone advert on television that I had seen as a schoolboy. I knew nothing, and I've learned a lot in a very short space of time. But in that time, when when things seemed so hopeless, as they did at the start of the COVID pandemic in some regards, things seemed so hopeless, the improvements in the treatments that we've seen, the fact that somebody on effective treatment can't pass it on, it's incredible. It's incredible what we've achieved, and it's testament to the hard work of so many in our life sciences industry, as well as in the NHS that my friend from Strangford mentioned there. And the all-party group on HIV and AIDS, which I'm very proud to co-chair at the moment, has been at the forefront of some of this work for the past 36 years. It's one of the longest-serving all-party groups around, and keeping it high on Parliament's agenda. And I'm very pleased to co-chair it, and I pay tribute on the record to Mark Lewis, who's here today, who looks after us, keeps us on the right track, keeps us focused. So the push to end new HIV transmissions by 2030, which the Honourable Lady in opening the debate mentioned today, is the right target. And the UK government, the Scottish government, the Welsh government have all committed to meeting this target by building on some of that work that I talked about just a moment ago. And I think that we can. I underline that. If Hansard could underline, I underline the word that I think we can get there. Yes, HIV care in our country today is excellent. The proportion number of people living with undiagnosed HIV has declined year on year, and the majority of people with diagnosed HIV are undetectable because of the treatment, the antivirals that they're on. So effective treatment and the combination HIV prevention, including the pre-exposure prophylaxis treatment, has resulted in a marked decline in new HIV diagnosis annually. However, I have to say, Mr. Gray, despite the fact that we've got access to all the tools we need to eliminate new HIV transmissions, we won't meet the targets that the HIV Commission set out 2030, nor the government's commitment to reduce new diagnoses by 80% by 2025, unless we improve testing along the lines has already been set out by other members today. Yes, of course.
I agree with what you're saying. It may be a matter that the Minister can respond to, or his committee can take up. A lot of the arguments have been won, for example, on the availability of PrEP and making services accessible. But that simply isn't happening, hasn't been happening. That's partly as a consequence of monkeypox displacing other services, but it's partly also because of lack of resources. And it does seem criminal that, because I have one of the biggest sexual health clinics in the country in my constituency, high prevalence locally in West London where I am, and people simply cannot get access to treatments, cannot get appointments at clinics, cannot get on the on the escalator, as it were, to treatment in that way. And unless we solve that, we can praise ourselves for having these solutions, but it's not going to work.
Well, okay, so it's a different point. The point I was making is that, when you think back to the hopelessness of 40 years ago, we have the tools to do it. This is my point. And he's absolutely right. I mean, the all-party group visited the Dean Street Clinic last year, and we heard about the impact that monkeypox has had on their day-to-day work, is still having on their day-to-day work. The access to PrEP through community pharmacies, say, would move the dial, would be a game changer, and that is something very much that I would support, and I'll come on to where I think I could possibly help on that with my chairmanship hat on of the Health Select Committee. So a number of people have mentioned the HIV Commission. I was very fortunate to have the proposition for that commission put to me when I was in the minister's job, and I and the member for South West Surrey and his successor as Health Secretary, it was an easy proposition to say yes to. And when I left government in 2019, I was asked by Ian Green from the Terence Higgins Trust to join the commission as a commissioner, which obviously I was delighted to do. And the National AIDS Trust, the Elton John AIDS Foundation, did such incredible work to put together that commission report. And as has been said, in 2021, on World AIDS Day, we published our report that developed the evidence-based recommendations that are now the foundations of the HIV Action Plan that my right honourable friend, the member for Bromsgrove, published in December 2021. And they were the foundations to the all-party group on HIV and AIDS report that was published in 2021 called Increasing and Normalising HIV Testing Across the UK. So I think the message from the HIV sector and public health professionals is to test. And late diagnosis, as has been said in the opening speech, remains way too high. There are still far too many people living with undiagnosed HIV who are not going to be reached through the existing testing strategies alone. So if we're going to find the estimated 5,000 undiagnosed people living with HIV in the UK, the testing must be normalised through the health service and beyond. And obviously we've made great strides in doing that, but we're going to have to roll it out much, much wider to the high prevalence areas, as has been said. Everybody should know their HIV status, and there needs to be equitable and easy access for everyone to this knowledge, and then the resulting effective treatment, so they can live their full and healthy life with undetectable HIV. We know that undiagnosed virus is a major contributor to the onward transmission, and therefore then the driver of late presentation and all of the impact on people's health, the impact on people's lives, and of course cost to the National Health Service, then which sadly significantly increases the risk of death in the first year after a diagnosis. We know that HIV testing is reliable, we know it's cost effective, we know it's highly acceptable to patients across a range of settings. You know, as we've heard from the lady from Arawash, HIV opt-out testing was an integral recommendation of the HIV Commission. We know that works. And I have to say, in latest data available, HIV opt-out in accident and emergency departments in London, in Manchester, in Brighton and Blackpool, as newly diagnosed with HIV, are 238 people. A further 124 people have been returned to care. So it proves that it works. We've proved the concept. And I'll be honest with the House, I was concerned as a commissioner that people would opt out or that they would take offence at the suggestion. What suggestion are you making would come back from the patient. And I was wrong. And you know, if you look at routine HIV testing that is done for pregnant women, this is completely normalised, and that convinced me it was the right to make that as our key recommendation. But key recommendation it is, but it's only in London, Blackpool, Brighton and Manchester. I've just been on to my trust in Winchester today to ask whether we can have a conversation about rolling it out into our area. Did Strangford wish? The voice of Strangford must be heard.
Well, only at your behest, of course. I can just say that in my contribution I referred to the pilot schemes and the success, and the Honourable Gentleman referred to that as well. But there's also cost savings to the health service by those who diagnose and find that they have it. And then the cost factors later on are quite significant. So therefore the small money spent now will be significant in the long run. Does the Honourable Gentleman accept that as well?
Yes, and that sort of takes us neatly on to my final point, is that, you know, with my chairmanship hat on of the Health and Social Care Select Committee, you know, we have just launched it. The call for ideas on that closes in just under 2 hours' time. We will be doing a major prevention inquiry, and there will be many work streams within that inquiry, and one of which will be a look at sexual health and HIV and AIDS, and this point that this debate is about today around testing. So, you know, this is for me a prevention issue. It's a prevention of ill health issue. It's a prevention of unnecessary suffering issue. It's a prevention of unnecessary cost issue to the health service and therefore the taxpayer issue. So, you know, I know that the sector is responding to our call for ideas, and we'll be getting underway with that work, talking to the Chief Medical Officer when we come back after half-term recess. So, look, I would say in closing, Mr. Gray, the opportunity to eliminate new cases of a long-term condition is very rare. It's very rare. We've got the ambition to do it, but more than that, we've got the tools to do it. You know, we've got to grab this opportunity. I think we would be missing the obligation upon us if we didn't grab that opportunity that's there. So, you know, I remain as optimistic as I was when the Commission was put in front of me. 4 decades on from a subject I knew nothing about. I know a little bit about it now, and it's doable. So, you know, we heard this afternoon from somebody who's shown what determination can do, and we have the determination, I hope. Let's use the tools in the box, Minister, and let's just get this done. It's a great legacy that could sit on your desk. Thanks, Mr. Gray.
Peter Gibson.
Thank you, Mr. Gray, and it's a pleasure to serve under your chairmanship, and it's a pleasure to follow my honourable friend from Winchester, and I pay tribute to him for all of his great work in this particular area. I also want to congratulate the honourable member from Erewash for being the one to secure today's debate. I know a good number of colleagues did apply for the debate, myself included, and I congratulate her for being the one to secure it and lead it so well. Mr. Gray, it also seems appropriate in this debate to make mention of the late Robert Keyes, the former member for Salisbury who passed away last week and who did so much work on this issue whilst a member of this House. Mr. Gray, I welcome that in 2019 the government committed to ending all new HIV transmissions in England by 2030. Normalising HIV testing is essential to meeting that target, and I myself have done my test this week, and I'm sharing the video and the means of obtaining a test on social media. Whilst new HIV diagnoses have continued to fall, late diagnoses continue to remain stubbornly high in England. This February marks the 22nd anniversary of the death of a good friend of mine from AIDS. He sadly died from many AIDS-related complications, but I am confident that had he been tested earlier and regularly, he would have been and given the right medication and would still be alive today, causing the mischief and merriment that he always did. I remember him and others at times of a debate like this. Mr. Gray, last week I had the privilege of hosting an event here in Parliament along with the Terence Higgins Trust, and it was a pleasure to welcome a number of colleagues who are here today. We met a young man, Oliver Brown, and Ollie is here in the gallery today. Following a cycling accident, he went to hospital here in London, where opt-out testing for HIV was underway. Had the hospital not tested him for HIV when they took a blood sample, Ollie believes that to this day he may not have found out that he is HIV positive. But thanks to that opt-out testing scheme, he is now getting the treatment he needs, and he can look forward to a normal, long life. The Terence Higgins Trust impressed upon us the huge and beneficial impact a further rollout of opt-out HIV testing could have. Opt-out testing for HIV has already been rolled out in emergency departments in the areas of the highest HIV prevalence in England, namely London, Brighton, Manchester and Blackpool. This testing has been introduced alongside opt-out testing for hepatitis B and C. Already in the first 10 months, this has led to more than 1,500 people being diagnosed with HIV and hepatitis B and C. So it is clear that opt-out testing works. Now, Mr. Gray, I am, believe it or not, old enough to remember the famous Don't Die of Ignorance campaign of the 1980s, for which we have Lord Fowler to thank for leading the way on raising this issue throughout his ministerial and parliamentary career. But there are generations of people who don't remember that campaign, and yet still 42% of people first diagnosed with HIV are diagnosed late. People diagnosed late with HIV in 2019 had a more than 7-fold increased risk of death within a year of diagnosis compared to those diagnosed promptly. We are simply not doing enough if we are serious about meeting our 2030 target. We have, as we've heard from the Honourable Member from Winchester, so many tools at our disposal to tackle HIV. I welcome that PrEP is available, but as we've already heard from my honourable friend on the other side, we need to do more to roll that out. There are still an estimated more than 4,000 people with undiagnosed HIV in England, and we need to be testing more. We also need to ensure that everyone diagnosed with HIV is accessing the care, because we know that if we do this, they can live, like Ollie, long and healthy lives. Whilst we take action on these fronts, we also need to tackle the enduring stigma that dogs people diagnosed with HIV. Only 38% of the British public know that someone with HIV on effective treatment cannot pass it on. Undetectable means untransmissible, and we must include spreading this message hand in hand with testing to end new HIV transmissions. Expanding opt-out testing has the potential to save the NHS more money than it costs and further reduce pressure on services. Terence Higgins Trust estimates that in the first 100 days of the rollout of opt-out testing, which has so far cost 2.2 million, around between 6 and 8 million has been saved by the NHS in care costs as a result of initiating treatment for those who need it earlier. This is a conservative estimate for the savings. We can infer that expanding opt-out testing for HIV and other blood-borne viruses nationwide would save the NHS even more in care costs. These savings come from the reduction in care a hospital needs to provide for newly diagnosed patients when we detect HIV sooner. At Croydon University Hospital, when they first started opt-out testing, the average hospital stay for a newly diagnosed HIV patient was 34.9 days. After 2 years of opt-out HIV testing, the average stay has reduced to a mere 2.4 days. So, Mr. Gray, we can save the NHS money, reduce transmission further, and ensure those who need it are getting the treatment they need. In essence, opt-out testing is a scheme that delivers a win-win-win scenario. HIV Testing Week is all about promoting regular testing, and it is disappointing that we have not yet managed to recover to pre-pandemic levels of testing. I hope that the Minister will confirm that they will keep a laser-like focus on this issue so we can continue to normalise regular testing across all of the most at-risk communities. As I've said, the government's HIV action plan is hugely welcome, but we must go further. I would urge the Minister to recognise the huge benefits of opt-out testing and do all he can to ensure we can roll it out to the whole nation. Test, test, test must be our mantra if we are to reach our goal in 2030, and I know that the government will have the support of everyone in this House to achieve that aim. I know too that the Minister will have heard the Prime Minister at PMQs, and I believe the Minister will be pushing at a very open door to secure the funding necessary.
Andrew Wynne.
Thank you very much, Mr. Gray, and it's, as always, a pleasure to serve under your chairmanship. I'd like to begin by thanking the Honourable Member for Erewash for securing this important debate and for the detailed way that she set out an argument that I don't think anybody could argue with or would want to argue with. She's a bit of a poacher-turned-gamekeeper as a former Public Health Minister, along with the now chair of the Health Select Committee. We have two people who've been directly involved in the policy formulation on HIV and stopping HIV transmission. And I want to thank them and the current Minister for the work that they do. I also want to refer, as the Honourable Lady did, to the new Chief Executive and the outgoing Chief Executive at the Terence Higgins Trust. Ian Green has been absolutely superb in leading that organisation and the campaigns that they have produced over many years and the successes that they have won from governments over those years. And I look forward to working with my good friend Richard Angel. He will be superb in that job, and I wish him and the whole team at Terence Higgins Trust the best for the future. I also want to add my thanks as well to Mark Lewis, who does so much work to facilitate the APPG. Often those roles go unthanked, but he puts in so much time and effort for the all-party parliamentary group. Mr Gray, as has already been said, last year we marked the 50th anniversary of the death of Terry Higgins, one of the first people in the UK to die of an AIDS-related illness. In those 50 years, we've come an awfully long way. Since Terry lost his life, we've seen major advancements in HIV treatment, in testing, and in tackling the bigotry and the ignorance and the misinformation. But I'd like to start this debate by acknowledging that those struggles have only happened, and those wins have only happened because of campaigners and researchers who have worked tirelessly to tackle HIV over those decades. The achievements over the last 50 years have been yours. And when we do end all new HIV transmissions in this country, that victory will be theirs too. And I think that's important to acknowledge. I'd also like to thank my honourable friend, the member for Strangford, the member for Winchester, and indeed the member for Darlington for the way that they set out their arguments, and particularly to the member for Darlington, who gave a very personal account, both here and at Prime Minister's question time, about the loss of his dear friend. And there are so many people like his friend who have probably needlessly died a very early death because of that failure to identify an HIV transmission before it's too late. The drugs have moved on massively, and we know that if we identify HIV, we can tackle that, we can get the viral load down, we can get the CD4 count back to normal levels, and that person can live a near normal lifespan, healthy lifespan, and that is a testament to the drugs that have been developed. Mr Gray, this week, as the name suggests, is all about testing, and that is a vital tool in our fight against HIV. Labour is proud to support the I Test campaign, which sits alongside National HIV Testing Week. People living with HIV can do so for a long time without displaying any symptoms. In fact, an estimated 4,400 people are currently living with undiagnosed HIV. So encouraging regular testing is therefore essential in ending new cases of HIV. Now, I went, along with a number of other members, to the National HIV Testing drop-in yesterday, and I collected a free HIV self-test. These are being distributed during this week, and with either a blood finger prick or an oral swab, it enables you to find out your results within 15 minutes. And again, that is transformational. You can get one of these by visiting freetesting.hiv. So anybody listening in can log on to that and get their test. And if the last 3 years have taught us anything, it's that getting to grip with at-home testing is surprisingly easy. So if you haven't tested, please do sign up online. Now, Mr Gray, 20% fewer people were tested for HIV in 2021 than were tested in 2019. And that's having a knock-on effect on treatment and on diagnosis. It is really important, therefore, that we do everything we can to drive up testing rates, which is why campaigns like iTest is so essential. Access to free at-home testing from a centralised source is only available during HIV Testing Week, and we know that for the rest of the year, access can generously be described as patchy. So I would be grateful then if in his response the Minister could set out what steps the government is taking to improve testing rates and how we can get tests like this into communities with low take-up. For example, given the success, as we've heard, of opt-out testing to areas of high prevalence, I would be interested in the Minister's response to the current scope of opt-out testing and whether there are any plans to broaden this distribution. Now, beyond testing, Mr Gray, there is still a huge amount of work to do in tackling HIV. During a debate on World AIDS Day, I spoke about access to PrEP. We know that around 40% of people surveyed struggle to access PrEP, and that there are huge issues with regards to resourcing of sexual health clinics. Unfortunately, we've still not seen the publication of a PrEP action plan, despite this being promised in 2021. Now, I understand from a recent response that the Minister gave to a written parliamentary question that the government does still intend on publishing this plan. That's all fine and well, but the HIV action plan aims to cover 2022 to 2025. We've already had a year of this strategy without a proper PrEP-specific plan. We can't afford another year without one. So can the Minister today set out a timeline on the PrEP action plan and whether the government intends to publish it prior to summer recess? Now, my next point, Mr Gray, is that last week the government announced its major diseases strategy, but there has been little or no clarity on what this means for sexual and reproductive health action plan, also long promised from the government. Recently, the Minister for Mental Health and Women's Health strategy said the government were considering the need for this plan. So can the Minister update the House on where these considerations have got to? We know that sexual health services have faced extreme pressure thanks to the Mpox outbreak, and that the capacity to deliver vital services has been compromised. So given this, it really isn't acceptable that strategies are being promised and then apparently disappearing into the ether. Finally, Mr Gray, on World AIDS Day last year, the Labour Party committed to scrapping the outdated barrier which prevents people with HIV from accessing fertility treatment. This is really important. So is the Minister able to confirm today that government will match that pledge? And if not, why not? Mr Gray, we've come an awful long way, but there are still legislative barriers in place which are based on misinformation, outdated information, and scientific ignorance. We in this place must remedy that. So in conclusion, I have no doubt that the Minister wants to see increased testing, that wants to see the UK reach that historic milestone of no new cases of HIV. And we support him in that and will do all we can to support the government in meeting that aim. But that shared goal requires action now. HIV is treatable, it is detectable, and new transmissions can be stopped. I would invite the Minister during this HIV testing week to redouble his government's efforts with regards to HIV transmission, to work towards a future where HIV is finally defeated, taking the foot off the pedal now, right on the cusp of achieving something truly extraordinary, would be a profound tragedy. We support the Minister in keeping the foot on the pedal and ending all transmissions of HIV in this country in the future. Thank you.
Neil O'Brien.
Thank you, Mr Gray. And let me start by thanking members from across the House for taking part in this hugely important debate, and congratulate to my honourable friend from Erewash for securing it. We've had excellent speeches from the honourable members for Strangford, Winchester, and a very moving contribution from our honourable friend from Darlington, talking about his friend, and indeed an important question from a member from Hammersmith. Throughout National HIV Testing Week, we're raising awareness of the importance of testing as part of HIV prevention. And let me thank members who have already taken part in the HIV point-of-care test at Portcullis House yesterday, delivered by the Terence Higgins Trust. And let me also join other members in paying tribute to Ian Green for his work on this subject. Our campaign aims to address barriers and normalise HIV testing and remove stigma by empowering and encouraging more people to know their HIV status. People can live, as many members have said, with HIV for a long time without any symptoms, and testing is the only way to know your HIV status. This is one of the cornerstones of our HIV action plan published in 2021, with the strong commitment to end new HIV transmissions by 2030 within England. The first HIV Action Plan Monitoring and Evaluation Framework, published by UCSA in December, shows there's much to celebrate in the collective progress that we've all made, with extremely high levels of antiretroviral therapy coverage and viral suppression. Still, as a number of members have mentioned, there are an estimated 4,000 people living with undiagnosed HIV. For those who are paying attention to this debate and listening elsewhere, testing for HIV is quick, free, confidential and easy, and it's fundamental to finding and diagnosing this population of people who don't know their status at the moment, to protect their health, as well as for efforts to stop HIV from being passed on. The vast majority of people get the virus from someone who is not aware that they have it. And what it means to live with HIV is also transformed over the last 4 decades, as my honourable friend from Winchester said, from a terminal diagnosis to a manageable long-term condition, thanks to huge medical improvements in treating the virus. As part of our plan, we're investing £3.5 million in the HIV Prevention England programme within 2021 to 2024, through which we are delivering the National HIV Testing Week. Last year's results were promising. 30% of the almost 25,000 users who ordered an HIV and syphilis self-sampling kit during the campaign had never tested before, and a majority of the campaign's target audiences reported having taken some sort of preventative action as a result of seeing the campaign. What's more, throughout this week, for the very first time, free HIV tests to test at home with a result in just 15 minutes available England-wide. As my friend from Erewash said, this is completely transformative technology, something we are now very familiar with because of the COVID epidemic. The test works in a very similar way to a COVID-19 lateral flow test, but uses just a few drops of blood from a very small prick on your finger. And alongside self-test, there's also an option for people across England to order a test, which is then sent to a lab and screened for both HIV and syphilis at the same time. The success of National HIV Testing Week is the result of close and collaborative working between key partners within and beyond government, and I would like to take this opportunity to thank them for their invaluable work. That, of course, includes HIV Prevention England team at the Terence Higgins Trust, who deliver National HIV Testing Week on behalf of my department. Local authorities and regional directors throughout the country are coordinating place-based and regional activities to further promote National HIV Testing Week. They will be promoting posters, digital imagery and other creative resources, as well as their own local projects and initiatives on HIV testing and prevention. Community and voluntary organisations have a key role in engaging their local populations and will also be providing testing and information in their local area as part of National HIV Testing Week. And I'd like to take this opportunity to thank them also for their vital role in helping us to end new HIV transmissions. We know that there is still more to be done to reach our bold ambitions. As part of our HIV action plan to improve testing, NHS England have made a £20 million investment in opt-out HIV testing in emergency departments in England, areas of extremely high HIV prevalence, to ensure that people get the right treatment as early as possible. And a number of honourable members have asked questions about this. Opt-out testing is a proven and effective way to identify new HIV cases, as it promotes testing on admission to hospital of anyone who's not been previously identified with HIV, therefore helping to rapidly identify the virus. 33 A&E departments are now live, delivering this important initiative, and we've backed this with funding to also provide a hepatitis B and C testing as well at the same time, partnering with the NHSE Hepatitis C Elimination Programme. And we are working closely with the NHS to understand the progress, challenges, results and learning from this initiative, and I'm taking a personal interest in it and the results that are starting to emerge from it, and have been considering the emerging evidence, which I think is extremely interesting and very exciting in lots of ways. We will be considering the evidence from the first year of opt-out testing alongside the data on progress towards our ambition to decide whether we further expand this programme. As honourable members will... I'm
very grateful, and it's right, we're talking about testing today and we're talking about recommitting to targets, but this is part of a strategy on prevention. And can I put the same points I put to the chair of the Health Select Committee? I'm sure he's seen the briefing from the National AIDS Trust and the Terence Higgins Trust, and the fact that sexual health services were displaced by MPOX principally about a quarter to a third of the routine work they do, including the testing prescription of PrEP, has gone, and that has not recovered a year on. So what is the government doing to ensure that clinics have the resources to do that?
It's good to come to the point and later on in the speech, but to answer the point directly, we're very conscious of the challenges thrown up by particularly in some areas, the extra huge volume of work that was caused by monkeypox. We have provided additional resources to the places that were challenged by monkeypox, but I'm conscious that that has slowed down some of the progress that we wanted. Just to finish the point that I was making about the opt-out testing, which a number of members had asked about, obviously the reason for starting in the areas of the very, very highest prevalence was that you have a clearly a better opportunity to have a good saving in terms of lives and health saved for a given investment. That's why you start there rather than in the low prevalence areas. And of course, there's a point of balance between how far you extend this out from the areas of very highest prevalence, and that is what the evidence we're gathering at the moment will help us to decide. I'm happy to give way to my friend from Darlington.
I'm very grateful for Mrs. comments in respect of opt-out testing in those high prevalence areas, and I wonder perhaps he could write to me and others who've attended the debate about what considerations the department has given to effectively looking at tracking people who've previously lived in those high prevalence areas who now no longer live in those high prevalence areas. They may have been exposed to those similar risks that make those areas high prevalence, but are now no longer in those local areas.
It's an extremely interesting question, and I hope we can do better than that, because we will be sharing evidence as it emerges to support other areas, to make the case locally for implementing that same approach in other areas of the country. The Honourable Friend raises one way of thinking about it, a new way of thinking about it, which we will consider, and we will be sharing the evidence as it emerges, because I know there's a huge amount of interest in this extremely exciting new approach. National HIV Testing Week gives us the chance to raise awareness of the importance of testing and the powerful role each one of us has to play in ending HIV by knowing our own HIV status. It's, and also an excellent reminder of the importance of the need for sustained collective effort to achieve our shared ambitions and to end new transmissions and deaths within England by 2030. Together we can be the generation that beats HIV. Oh, sorry, there was a very directly asked question from the opposition front bench. And before I sit down, let me say that the PrEP action plan will be published before summer recess.
Maggie Throop.
Thank you, Mr. Blair. I appreciate the opportunity to wind up this debate. We've had a very productive debate and also a very knowledgeable debate today. And I'd like to thank contributions from across the floor today. My honourable friend from Winchester brought a great deal of knowledge and expertise to the debate, gathered over a number of years, and I'm going to use the words of the opposition spokesman, and the fact that we have got two poachers gamekeeper in today's debate just shows how important the issue is. My honourable friend from Darlington spoke so gently about his friend who sadly lost his life due to complications of HIV/AIDS. And it's for those people that we need to get it right now. It's for those people that we do need to eliminate HIV by 2030. And the Honourable Gentleman for Strangford brought the international element to the debate when he spoke about the work that some of his local people are carrying out in Africa. And we must never forget that even though we're making great strides in the UK, that other countries are actually quite a long way behind us. I don't think I quite heard from the Minister, who I respect deeply, and I'm really pleased that he's committed to continue with his personal interest in this, that we'll be rolling out the opt-out testing to areas of high prevalence from the areas of very high prevalence. And I'm disappointed in this because the boroughs across London have already done the work for the department. The funding was just for the boroughs with very high prevalence, but London as a whole decided to roll it out across all the boroughs, partly because people do move so closely within the boroughs. It's been shown that there is a take-up of the testing, and the finding cases in areas of London were perceived to be just areas of high prevalence. So if we can follow up on that later, I'd appreciate that to make sure that we can speed up the rollout to the high prevalence areas, and we just don't wait too long, where we'll find that more people, such as my honourable friends do lose their lives. Because I actually do think, Mr Gray, that we have got the opportunity now to eliminate what has been a killer disease, and that opportunity is in our grasp. and we cannot let that opportunity slip through the net. So we must all do whatever we can to make this happen and make sure that opt-out testing is there wherever we are in the UK. Thank you.
The question is, this House considered National HIV Testing Week 2023. As many of you can say aye. Contra, no. The ayes have it. The ayes have it. And I suspend the sitting until 4 o'clock. Order.